So I got a rec for a 2-view chest. So the first thing I'm going to do is take the rec and come over here and bring it up on our computer system. So I'm going to scan the rec and bring up the patient and make sure that on the menu is the views that I have, which would be a PA chest and a lateral chest. And the next thing I'm going to do is come over here to our console and make sure I have it set on the correct item. We have it on a wall bucky. All of our cells are lit up. I have it on AEC. I'm going to do, I have my KV set at 110, but it could be anywhere in a range from 105 to about 120 on our KV, and anywhere from about 4 to 8 on our mass for our PA. You can do anywhere from about 105 to 120 KV for the lateral, and you do about 8 to 20 mass for the lateral. So now that that's all set up, I'm going to go get my tube set up. And I'm going to make sure my tube is on D10, which it is now, and it is set at 72 inches SID. I have the light collimated to the correct size of 14 by 17. I have my cassette in here lengthwise. We're doing a female chest. So my cassette is locked into the wall bucky, and I'm going to put my marker on. And now I'm set to go get my patient. Hi, my name is Bri, and I'm going to be doing your chest x-ray today.
Hi.
Can I have your name, please?
Andrea.
And when's your birthday?
3/16/89.
Okay, is there any chance you could be pregnant?
No.
Okay, follow me right this way. And I'm going to have my patient change into a gown, make sure she has nothing on from the waist up, shirt removed, bra, any metal, any jewelry, necklaces, belly button ring. She has it all taken off, and there's no chance she could be pregnant. So you're come right over this way. What brings you in today?
I have a cough.
Okay, so I'm going to have you go ahead and face this board. I'm going to make sure her mid-sagittal plane is parallel with the IR. I'm going to make sure she's shielded because she is of childbearing age. Alright, I'm going to go ahead and have you put your hands on the back of your hips. And she's centered. So her mid-sagittal plane is centered with the board, and we're centered at the level of T7. So I'm going to have you go ahead and roll your shoulders forward, and still just like that. And take a deep breath in, hold it, beep, breathe. You can go ahead and relax for a minute. Now I'm going to take my film out and run it. I'm going to make sure that I scan the cassette and it's under PA chest, and I'm going to stick it into the reader. And I'm going to grab my next cassette for my lateral. So my marker's still on here, and once again, I'm going to keep my KV the same. It's at 110 right now. And my mass is going to go up from my lateral anywhere from 8 to 20. So I'm going to go ahead and turn your face this way, up against the board. And go ahead and put your hands on top of your head. Alright. And once again, the light is centered mid-sagittal plane parallel to the IR. I'm going to make sure her back is straight. I'm going to kind of rotate it just a bit to make sure the vertebrae are superimposed. Just a slight rotation. Right, and once again, we enter at the level of T7. Alright, go ahead and hold still and take in a deep breath. Hold it in. Beep. Breathe. You can go ahead and relax. Alright. I'm going to take out this cassette. I'm going to run this film. So this is my PA chest. In order for it to be a proper diagnostic image, there are some criteria that need to be met. First off, we need to make sure that the entire lung field is included from the apices to the costophrenic angles. The scapula need to be out of the lung field. To make sure there's no rotation, the sternoclavicular joints should be equidistant from each other. We need to see 8 to 10 ribs visible, and there also should be the shadow of the thoracic spine seen through the heart. And we also need to show evidence that of collimation. We try to collimate, and our markers also need to be visible. And for the lateral view, the ribs should be pretty much superimposed on each other. The hilar region should be shown here, which is in the center. The humerus needs to be out of the lung field. And once again, the apices and the crostophrenic angles need to be shown and not clipped. There should be some signs of collimation, and the markers need to be included. And then it's an acceptable diagnostic image.